In practice, thoracic oncologists often encounter patients with severe comorbidities and limited respiratory reserves. Bronchoplastic surgery in such cases is an extremely relevant and promising method. There is a certain number of patients who are unable to undergo pneumonectomy, and standard lobectomy, due to the spread of the tumor process, cannot ensure the radicality of the operation. Thus, the patient's state of health does not allow radical treatment and the patient loses the chance for a full recovery. As a rule, patients with resectable tumors, but with a forced lung capacity of less than 1.5 liters, a forced lung volume in 1 second of less than 800 milliliters, or a ratio of forced lung volume in 1 second to the forced capacity of the lungs is less than 0.7, and the diffusion capacity of the lungs in relation to CO2 is less than 40%. On the basis of the Department of Lung and Mediastinal Tumors of the Scientific and Clinical Department of Thoraco-Abdominal Oncology of the Clinic of Oncology of the National Cancer Institute. Extended lobectomies, circular, windowed, wedge-shaped, were performed, and the 3-year survival of patients who, due to concomitant diseases or low respiratory reserve, were suitable only this method of surgical treatment. Treatment of patients with bronchoplastic surgery was carried out within the framework of treatment standards for cancer patients. In this study, patients with stage IIB and III A non-small cell lung cancer were surgically treated after 4 cycles of chemotherapy. The study evaluated 110 clinical cases of non-small cell lung cancer, 70 patients with stage IIB and 40 patients with stage III A. Age, localization of the oncological process and stage of the disease were similar to the indicators in the control group of patients. 20 bronchoplastic lobectomies with wedge-shaped resection of the bronchus, 20 bronchoplastic lobectomies with window resection of the bronchus, and 70 bronchoplastic lobectomies with circular resection of the bronchus were performed. Postoperative complications and overall 3-year survival were analyzed. As a control group, 70 patients with stage IIB and 40 patients with stage III A were selected, who underwent the same course of chemotherapy, in which the functional status allowed to perform a larger volume of surgery and in which standard pneumonectomies were performed. The results of treatment were as follows. With stage IIB, the 3-year survival rate was 67% in the observation group compared to 57% in the control group. At stage III, the 3-year survival rate was 40% in the main group, and 33% in the control group. 10 patients who underwent bronchoplastic lobectomy with circular bronchus resection were diagnosed with pneumonia in the postoperative period. In the control group, this complication was noted in 7 patients. No other postoperative complications were noted. The duration of the postoperative period did not differ in both groups and was 6 to 7 days.